Hi, Dr. Jaffe. How would you guide a practitioner on the appropriate incorporation of PERQUE D3 Cell Guard into their patient supplement regimen? And how often would you recommend testing D3 levels when active D3 supplementation is underway to correct deficiency?
Well, we call it vitamin D, but it's really a neurohormone. It does everything that neurohormones do. Most importantly, it helps cells tell whether they should divide or not. Vitamin D kind of has two arms. One arm goes on cell number 1, and the other arm looks for an adjacent cell, cell number 2. If it finds an adjacent cell, it sends the message to the nucleus of the cell to stop dividing, we have enough cells. If it doesn't find another cell adjacent, it says proliferate, make new, more cells. What do neurohormones do? Well, neurochemicals and hormones. Stress hormones, male hormones, female hormones, they're all hormones. They're all influenced favorably by enough vitamin D, and that is 50 to 80. The range for vitamin D should be 50 to 80. I know the nation has less than 20, but the nation is deficient. Most people are deficient in vitamin D. So I would give D3 Cell Guard drops to everyone. Now, how often would I measure the vitamin D level? It turns out that vitamin D levels change rapidly. You can measure in as short as a month, as soon as a month, or you could measure every 3 months or every 6 months, depending on your standard of care and style of practice. But if the question is, how rapidly does vitamin D change and how quickly does it come to a new equilibrium, to a new level? It's about a month. So you can measure and confirm the benefit that quickly, or you can wait and confirm later, knowing that vitamin D is doing its job as a neurohormone involved in hundreds of intracellular communications. I could get into the weeds, but I think that you understand that it is a neurohormone, that it does everything inside the cell to make the cell better, stronger, faster, more efficient. The protein synthesis is better when you have adequate vitamin D, etc. So vitamin D goes everywhere. It does lots of things, more than we imagined. So you have to get over the idea that it's a vitamin, understand that it's a neurohormone, and understand that drops under the tongue get through the mucosa easily, whereas from the intestines, the uptake is often impaired. So how quickly can you measure? 1 month or more. What is your goal? 50 to 80. How do you get there? Drops under the tongue.